It gives me great pleasure to introduce another presentation from Dr. Radhika Injamuri, who is an Associate Professor, Department of Kaumarabhritya, and her lecture is Ayurvedic Management of Common Behavioral Disorders in Children.
Good afternoon. Welcome you all to the World Health Congress 2023 Prague. Myself, Dr. Radhika Injamuri. Today I am here to share my deliberations on topic Ayurvedic management of common behavioral disorders in children. According to Center for Disease Control and Prevention, behavioral problems are affecting 8.9%, that is approx 5.5 million of children aged 3 to 17 years. The incidences are increasing with irregular lifestyle modifications of parents leading to the genetic susceptibility, which in turn are the cause for mutations in the generations to come. Here I am putting forth the effort to just give a basic note on Ayurvedic management strategies available, which are proven to be effective. There are good number of behavioral disorders to list upon, but here I have listed quite common ones in any pediatric practice. The list goes as breath-holding spells, bedwetting, pica, autism, ADHD, and mental retardation. Coming to the breath-holding spells, these are the reflexive events which occur due to provocative event that causes anger, frustration, or pain, and the child starts crying. So when a child is being asked for anything which has not been provided, then the moment the child gets into anger and frustrations and start crying. And usually it starts above 6 months and remains peak at 2 years and slowly gets reduced by the growing age. And the most common underlying cause is said to be the high pampering by the parents. And in this condition, the child stops crying at a point of the full expiration and because of and holds the breath, due to which the child becomes apneic, cyanotic, or pale, and the child may become unconscious and appears as a seizure activity, which is most difficult part for a parent to take. In coming to this management, as in breath-holding spells, iron deficiency is said to be one a remote cause, so hence iron supplementation is suggested with iron-rich foods and Medhi Rasayana and Satvavajaya Chikitsa. Coming to the second disease, common one is bedwetting, which is termed as when a child passes urine on bed at least twice in a week for at least 3 consecutive months, and the age of the child to be of minimum of 5 years. And this is of 2 types, primary and secondary. And this is going to be another based on the time like diurnal and nocturnal. And the causes are like the organic causes goes as myelomeniingocele, spina bifida, and the most common consideration goes to the non-organic causes like psychological stress, sleep disorders, school change of the child, maturational or developmental disorders, or the genetic disorders. Secondary causes goes with UTI, constipation, worm infestation, diabetes, and school change, and any new child born within the family, or any sudden death of a person in the family. The Ayurvedic management, the root of Coccinea grandis is been given, and Balarishta, Murva, Medhi Rasayanas, and the child is said to undergo the main behavioral therapy, that is the alarm therapy, and non-pharmacological therapy, that is alarm therapy, and toilet training, also a motivation therapy, along with Satvavajaya Chikitsa. Coming to the pica, this is said to as having a non-nutritive substance intake at least for a period of 1 month in less than 5 years, and the causes could be mental retardation, pure socio economic status in which the child suffer with malnutrition, and hence the child may tend to take such Non-nutritive foods, like it could be plastic, charcoal, paint, earth, mud, soil, any such, and also sometime with parasitic infestations. So the Ayurvedic management is said to be as in Ayurveda, it is said to be as Mritpakshijanya Pandu. It could be correlated with this disease, and where the vitiation is due to ingestion of Mrit, and that is the mud or soil which has a different rasa has been identified. The mud or soil which is going to have a Madhur rasa increases Kapha, and Kashaya rasa, that is astringent rasa, is going to increase Vata, and Ushara is going to increase the Pitta. And the Dushas are Rasavashrutas, and Sangha is going to be the obstruction of the channels, the Shrutas. And the management is Shodhana, where Virechana is to be done, the purgation therapy, and Tiktarasa processed foods or the grita, that is the clarified butter, is to be given, and the worm infestation treatment, that is antihelminthic. Ayurvedic drugs are suggested, and Chatvavajaya Chikitsa, and addition, iron supplementation in the form of food and medicine has to be given to the child. And coming to the most common the disorder seen as autism, in which a child appears to be having this particular disorder at 3 to 5 year old, and the cardinal or the hallmark feature is going to be lack of social and communication skills, and there won't be any reciprocal social interaction with a stereotypic behavior and restricted interest in activities, but isolated remarkable talent will be seen in the children. These children doesn't have a peer relationship, and they lack sharing with the peer group, and no reciprocal emotional reciprocity is expected, and there will be a delay in the speech. And the management is identified by or planned with the predominance of the dosha and the severity of the condition, where Deepana Pachana Aushadha are given, and the Medha Rasayana and Ushnavirya Dravyas, like Deepana Pachana Aushadhi, like Chitrakadivati, Mrudu Rechana with Abhyarista if the child has any other issues of constipation, and Medha Rasayanas like Saraswati Grita are to be given internally and as nasya, that is through the nasal route. The same, the Medhya Gritas, that is the clarified butter form of medicated Grita, medicated clarified butter is going to be instilled through the nostrils, and externally the Kshira Bala Taila to elevate the Vata, and also Vasti, the enema therapy can be planned with any Vatahara Dravyas. Also added up with Shirodhara, that is either it can be a Thailadhara, preferably a Thailadhara. The oil, medicated oils can be chosen and to be dropped over the forehead, so that the calmness of the child will be brought, and also the diet plays a bigger role, like unsaturated fats, fish, lean meat, fresh fruits and vegetables, more intake of water, and gluten and casein-free diet is suggested, where the barley and wheat and the such grains are to be avoided, and the diet plan should be like nourishing the Majja Dhatu and balancing the Vata dosha. And the other disease is the ADHD, attention deficit and hyperactivity disorder, where 8.4% of the children are suffering with this, and more of the cases, the incidences are increasing. Here the child appears with the three main cardinal features, that is attention deficit, hyperactivity, inattentive, and impulsive, being impulsive. And this disease is going to be should begin within 7 years of age, and it should be for 6 months and not to be secondary to any other disease. And the same behavior should persist in 2 different conditions. And the main cardinal features are inattentive, hyperactive, and impulsive. So the child will be inattentive, that is having early distraction, difficulty in sustaining attention, being forgetful, fails to do school works and gets confused. And hyperactivity represented in form of fidgeting with hands and feet, squirms in a seat, runs or climbs, and non-stop talking, can't sit in one place or cannot do the tasks which are being given. And also, the third cardinal feature is impulsive, being impulsive, so where the child cannot wait for their turn in the games or any of the activities, blurts out answers to questions and interrupts the conversations. So the Ayurvedic management for this, where the child usually given a brain calming techniques like Shirodhara with the medicated butter, which includes the medicated treatment medicated butter, buttermilk, and cold substances application of with the medicated herbs over the head, and Medhya Rasayana with Shitavirya Dravyas. So the Medhya Rasayanas are nothing but the nootropic drugs, and there are a good number of choices for the Kalyana, the medicated sutras like Kalyana Krita, Ashtamangala Krita, and the enema with any of the customized as for the child, the medicated ghee to be chosen, and also the Satvavajaya Chikitsa. And coming to mental retardation, so this is again one more common disease which has been since ages, and the disease causes goes with different domains like in intrauterine period or at the time of birth, prenatal, perinatal, and postnatal causes. The management, the brain stimulants, that is nootropic drugs, are especially Ushnavirya Medhya Rasayanas are to be chosen, and the Shirodhara with medicated oils can be done, and Vasti and Nasya, that is nasal drop installation with the Medhya drugs, and also the Satvavajaya Chikitsa. So here, in all the most of the behavioral disorders, we have come across the word Medhya Rasayana. So what does it mean is it is a nootropic herbs which are used to boost the cognitive abilities. So we have good number of such in Ayurveda, like Manduka Parni, which is said as Centella asiatica, Guduchi, Tinospora cordifolia, Shankapushpi, Convolvulus pluricolis, Kushmanda, Banankasa, Hespida. All these are like etc. And such drugs can be used alone or in a polyherb preparations. So hence these are going to be increasing the cognitive abilities in a child. And coming to the Avajaya Chikitsa, Sattva is mana, that is mind, and Avaja, that is conquering or getting a win over, that is controlling over a mind, is said to be Sattva Avajaya Chikitsa. As even in the physical disorders, the manas, that is the mind has, that is if a child has a strong will, it is going to help to cure even the physical diseases. In such, this Sattva-Avajaya Chikitsa, which is said to be as a trance therapy or psychotherapy or a clinical hypnosis, is said to elevate the vata, which contains an Panchamahabhuta like air and ether, which has the children which are suffering with this will be having a manoguna as rajasika, which is a catabolic and anabolic in nature, and withdrawal of mind from unwholesome object is said to be Sattva-Avajaya, or the treatment to achieve self-control. So in which the yoga is said to be the best, and the self-hypnosis therapy like positive suggestions and counseling plays a greater role. And also added with the Sattva-Avajaya Chikitsa includes assurance, retraining of the ideas, replacement of emotions, regulation of thought processes, channeling of the presumptions, proper guidance, and control of the patients. So with all this, you can bring a lot of change in the children's behavior, and added with the parent should have a consistent behavior, and the plan of treatment should always include for school age children and teens. The effective treatment is going to be a combination of training and therapy that includes the child, family, and the school. So with all this, I thank the organizers for giving me this opportunity. Earlier in 2021 also, I had this presentation of poster presentation, and now I have given this oral presentation, and in the coming future days, hoping to meet in person. Thank you.
And from our side, many thanks to Dr. Radhika Injamuri for her presentation.